Thank you so much to Dr. John Tay and Chloe Jean Tay from PlantMed Clinics. The Tays have been a long supporter of MardiGrass and cannabis law reform, and it's very exciting to have you back here again this year. And you're going to talk about your medical cannabis journey and how things have gone so far and what ideas they have for the future of medical cannabis in Australia. They'll be covering any pitfalls and highlights and where to from here. And Dr. John Tay and Chloe Tay are from PlantMed Clinics, and they've been involved in the medical cannabis space since before it became legal in Australia in 2016. And they've, over the years, they have assisted thousands of patients to achieve better health through cannabis medicine. And, you know, from arthritis to terminal cancer, their technique is unique, and they always place the patient at the forefront of their treatment process. So thank you so much for coming and sharing today. Over to you.
Thank you.
Thank you very much. Well, for those of you who don't know me, my name is John, Dr. John Tay, or Dr. Tay, a lot of people call me, or John. Any name I'll go by. But we want to have a conversation today, and I've done a lot of talking, and I've talked at a lot of these events where we've explained about the endocannabinoid system. We have the slides with the pretty pictures. But today we just want to talk to you. And to be honest, our lives have become so busy that we haven't had much time to prepare anything except for an off-the-cuff conversation. But I suppose what it comes down to is the fact that we believe in cannabis as a medicine, and we have done this and believed in this for a long time. So my personal journey with cannabis started probably when I was a student at university. I think maybe a little bit earlier than that, at the end of high school, you know, in a normal social, recreational way. And it was fun for me, and I had a fun time at university, and I studied medicine. And then I was working in medicine, I was working in several fields, and nothing really tickled my fancy. And I didn't want to specialise, I didn't want to become a surgeon, and I didn't want to become a heart doctor or a psychiatrist. I thought I did, but when I got there I realised it wasn't really for me. So I ended up in a backlots area of medicine, in a way, with no career progression, but a comfortable spot doing private surgery in the hospitals around Brisbane and Queensland. And cannabis fell to the back a little bit for me. And I wasn't smoking cannabis for a long time because I actually experienced a few little mental health conditions myself, a little bit of anxiety, and it wasn't working for me as a medicine like it used to at the start. And I suppose in hindsight, I now know that's because I didn't have any CBD in my system, because we didn't know about that back then. Well, I didn't know about that back then. And then I met my wife, Chloe, one day, and I'll let her tell you a bit about her story and how she got into cannabis, and then I'll come back and continue mine.
Thanks, Darlene. I suppose it's, I don't know, it was a serendipitous meeting of the minds, to be honest with you. It was a classic case of stoner meets doctor on the other side of the world. I came from a cannabis-producing family, both indoor and outdoor. Cannabis has been my life. It's been my life since before I can remember. Cannabis consumption within my family setting was just that. It was a medicine, where it was promoted as a medicine. It was grown in the veggie patch next to the rest of our herbs and vegetables. So I grew up in a completely different mindset to what a lot of society did in the 80s and the 90s, but that also gave me a lot of background information and a lot of sites that I've seen that have enabled us to allow for a much better clinical application of cannabis in naive patients. So I was over in Europe and I met this amazing man out of nowhere, and I thought to myself, shit, okay, I better tell him who I am and what I do and let the chips fall where they do. So I literally, after meeting him, I just said, look, I'm a stoner. I've always been a stoner. I like weed. That's not going to change. Is that okay with you? And I remember that conversation so vividly, because he was like, yeah, that's fine with me. Like, I don't do that myself, and I've kind of scared myself a little bit in that area, but that's cool with me. And that was a very moment where I said to him, I'm like, you're not smoking dirty hydro, are you? you know, and that was the first conversation where stoner meets doctor and can allow for us to cross over into a medicinal cannabis market. And from that moment on, that was 2013, so this was well before legalisation, we kind of came home and our lives slowly merged together. And that was when we had our first patient approach us just before legalisation with a glioblastoma. She was a good family friend of ours, she was 21. And that's where our journey into the medical properties of cannabis really started. And yeah, Nikki approached John, and at the time we just dove so deep into any research and information we could. That was when I actually met and fell in love with the Nimbin community and their open-mindedness and their non-judgment towards people's conditions. So, you know, personally myself, I came and sourced some medication for Nikki, and from there was where John worked his magic.
Yeah, so this job picked us, I suppose. We actually have a place just down the road and we're planning on getting married and having a couple of kids, growing some veggies and doing what you do around these hills, you know, not much. But as that first child was born, we were presented an opportunity, and a wealthy investor couple had a spare room for us and put a little bit of money behind us, and we had no money at this point, and we started out treating patients, because just by word of mouth, more and more people got my phone number. They started looking up Dr. Tay, but they ended up getting my dad because I wasn't listed in the phone book. So Mum would take the message like the old school days in 1980 and write them down and then ring us and tell us to ring them. And that's how we started. And then it slowly built from there. And the reason I told you about the slightly embarrassing stories about, you know, not being 100% in control of my cannabis use as a youngster is because it gave me a lot of empathy for the problems that we can face and we do see regularly in my clinical practice and in our amazingly fortuitous practice of PlantMed, where we have helped over 10,000 patients, I think. The numbers are just keep going. And every day I go to work and I think to myself, are these good results going to keep going? You know, like at least 80% positive results. We haven't actually had the time to do the studies, but just the return custom and the building of the custom show us that this is an amazing medicine. And I think the proudest achievement of what we've achieved so far in the space, and as mentioned, we are very forward. We'll tell you our stories. We put on an event called the Australian Cannabis Summit each year, which is an online and a real-world event as well. We've just recently put together an educational platform for medical cannabis called PlantMed, and we continue to push forward in the medical cannabis space. And one rule we have at PlantMed is that CBD is essentially mandatory. If you're going to take any amount of THC with us, you will get prescribed the balancing amount of CBD. And where it comes back to is that balance, I think. And we've kind of lost the balance a little. Back in the 70s and earlier, our THC to CBD ratios were so much different than they are now. The cannabis is much weaker, and it was about 4 parts THC to 1 part CBD. There was a significant amount in there. Now we've got massively strong THC and 0, if any, CBD found in most of the strains grown recreationally. In the medical market, we're bringing back that CBD. And that CBD is the balance of the plant, in my opinion. And that balance of the plant then gives us balance in our minds, and that gives us the healing that we're looking for. So, yeah, I think since 2016, it's just been a roller coaster, and we haven't had time to breathe, haven't had time to stop, and it's just a matter of treading water and trying to keep up with what's occurring and not stumble and get left behind. And we've managed to do that so far. So, That's my proudest emotion, I think, about this whole industry, is the way that we've created this company with no backing from the big guys. You know, we just did it on our own. And I'd really like to thank Chloe, actually. So, yeah, I'll hand over to you. Yeah.
Thank you, darling. Appreciate that. This journey's been a little bit bigger than us. It started out of our control. We had a 4-week-old baby. The company and the baby was born at the same time. It's grown exponentially since then. But the key defining factor for John and I is focus on the clinical outcome of the patient. See the patient as an individual. You don't see the patient as a number. You don't see them as a dollar value. If you're in the industry purely to make money, your motivation is wrong and you're not going to succeed. So what we've done within PlantMed is ensure that whatever we're doing, we are setting the best example possible to the rest of the medical industry, because our biggest supporters and our biggest judgments right now are coming from the medical industry itself and other medicos who are still plagued by prohibition and incorrect information. And going back to that alone, the issues we're seeing within cannabis now, they're not cannabis's fault. They're the fault of prohibition. Prohibition made us hide our plants. Prohibition made us take our plants indoors. Prohibition made us grow cannabis for THC strength and not balanced endocannabinoid function. So at the end of the day, what we're really dealing with at the moment is dispelling myth and dispelling propaganda. And that's really one of the main things that John and I have focused on doing from the start, is lead by example, but also lead with correct information to the medical community. And right now, due to a couple of scrupulous players within this space, we are facing a lot of pushback right now from our fellow medical community. And the only way that we can change that is by educating the medical community on what is going wrong within this space.
And what Chloe's alluding to there is mental health. So at the start, when we started, there really wasn't many doctors at all. There was a handful, like all two of them would be here at once in the early days in a few years ago. And now there's probably, a few hundred Australian cannabis doctors that prescribe cannabis. But in terms of morality and ethics, some of the companies and clinics out there aren't really servicing the people. They're servicing their own pocket. They're servicing and facilitating selling large quantities of cannabis at the expense of the grassroots people who grow the cannabis in these areas. Even it extends that far, the amount of cannabis that's coming into the country cheaply and being distributed without medical supervision, essentially. And there's plenty of... We've maintained a fee structure at our clinic, and it hasn't changed since we started. So you have to pay for a service, and I think that's a fair thing. And a lot of the clinics these days are offering $20 or $0 consults. So you're talking to a doctor very briefly and essentially getting a sign-off and getting sent your weed. With no care about the mental health of that patient, no care that there's no CBD involved in it and you may be going to give someone with anxiety worse than anxiety. No care as to the strain that you're providing or chemo you're providing to help with sleep rather than a wakefulness, so maybe giving someone a sativa at night, for instance. No care about the patient. And as a result, there's been a noticeable increase in the number of cannabis-related psychoses entering emergency departments. And the emergency department doctors are seeing it, and the psychiatrists are seeing it. And that's because the majority of the people doctors in this space are connected to these less scrupulous companies. And because we can't even advertise, we're not allowed to put an ad in because of the drug rules. No one can, supposedly, if you're a doctor at all, really advertise yourself. Because we follow those rules and we don't do that, and these less scrupulous companies have large pockets and are able to advertise and cop the fine, and you've probably seen one of the larger ones in the paper at the moment in the federal court for just flagrantly breaking these advertising rules. Well, that puts us ethical people at a distinct disadvantage. And how do we tell people, make sure you check you got the right doctor, make sure they know what they're doing, make sure they're going to help you, not harm you. And that's a big thing. So we're facing that in the colleagues that we talk to now, and we're getting kickback on that. So that's where the education comes in, and that's where balancing with CBD is so important. And that's where Chloe and I have been very active in promoting that fact and driving that fact home to the wider population. And educated rooms like this already know it. We're preaching to the converted. But when you're talking to the wider medical community, they don't know the difference between THC and CBD, let alone sativa and indica, or haze and a kush. They don't know those things. And that's the problem. So it all just gets tarred with one big brush, and that brush is bad for the industry, and that's bad for the progression of this industry.
Absolutely. And a lot of things that we're also seeing around medicinal cannabis scripting is really a lack of education in a medico sense. You know, the lack of consideration for short-acting medicine versus long-acting medication, the lack of consideration as to what is a therapeutic dose range, what are we actually trying to treat, are we using the correct cannabinoid for what we're trying to treat. There is a lot of things that just aren't being considered, and because of the lack of consideration of how cannabis works within our bodies, we aren't seeing the best clinical outcomes we could possibly see in this industry. And in order for this to be accepted as a mainstream medicine, we need to really focus on the clinical outcomes. If you focus on the clinical outcome of a patient, that referring doctor's attitude towards cannabis will change. If we do it wrong, that will be the last referral you'll ever see from that doctor as well. So how you integrate cannabis into patients is incredibly integral, but it's mostly integral for the referring community of that patient to see that this stigma isn't actually warranted at all. This medication is incredibly powerful. It can allow for polypharmacy reduction. It can allow for quality of life. It can allow for reducing disease progression. It can do a lot of things that we as a medical community aren't really willing to accept yet. And if we don't focus on the patient first and foremost, the further away the rest of the medical industry is going to move from people like us.
But we're working on that one, and the attitudes are changing. They really are. We've got quite a large group of specialists that now refer to us at PlantMed. We get cancer specialists and orthopedic surgeons and pain specialists.
Paediatricians, massive market.
Lots amount of paediatricians, psychiatrists. You know, there are the segment of support from the medical community is growing day by day, and it will become mainstream. You know, within the next 5-10 years, I can see it happening, and we're going to push for that, and we have to maintain that and make sure it doesn't get lost up in the recreational legalisation that will also come with it, I think.
And cost is important as well. So as a patient, really, where does your cost lie? The cost isn't in the specialist doctor that you're seeing to prescribe your medicine. The cost is in the medicine itself. This is a medicine you're going to have to consume potentially 3 times a day and every day for the rest of your life. So when you are a patient and you are considering entering into a medicinal cannabis prescription, you really want to look at the cost of the medication. You also want to make sure that you've got both cannabinoids being represented in your medical treatment, because this allows us to significantly reduce the doses of cannabinoids, making your treatment a lot more cost effective in the long run. So when you are considering treatment, consider the doctor. Do they specialise in cannabis? Are you the first glioblastoma patient that they've ever treated, or is there a history of this doctor working with complex medical conditions? What ratios of cannabinoids are going to be used? What level of ingestion? Will it be fast-acting flowers? Will it be long-acting oral medications? And then from there, what are the costs of those? Because another thing that we have seen quite a bit in the industry is when we don't use our cannabinoids effectively, dose rates of patients massively rise. So we can see patients consuming upwards of 90 grams a month of flower. If we were to do that treatment correctly and introduce both a short-acting medicine, flowers, and a long-acting medication, we can reduce those intakes by at least half and get a great clinical outcome. So when we treat a patient, we're not just thinking about the patient. We have to think about the family. We have to think about the cost to the family. What type of lifestyle is a family going to have if they're buying over 120 grams of flower a month? Can we reduce that down to 30 grams a month and incorporate some long-acting oils as well, and then give that family back an extra $900 in their pocket? So we really have to think about the patient. We also have to think about how we're going to improve their lives and get them back into their communities and their families.
Yeah, and I think cost is something which is essentially already equilibrated between the green market and the legal market we have now. You know, we sell ounces of high quality cannabis for under $300 now, an ounce, which is very standard. it does go a little higher, but the prices are not excessive in any way. And in terms of CBD, I do believe that CBD is actually cheaper in some brands now within the medical market than it is in the green market, which is great. We're down to less than 3 cents per milligram on CBD, which allows us to use it liberally with patients and actually get decent results, whereas before we were scrimping and saving. When we first started, to put that in perspective, you'd be paying 19, 20 cents a milligram for CBD in Australia only 7 years ago. So now that's come down thousands of %.
Yes, when we started, we were seeing medications sitting around $600, $700 a bottle, and now they're down to just over $100. $85. So the medication now is becoming very, very cost effective, and it does allow for any patient who may be out there self-medicating to cross into a medical market, and that not to impact the fees and the costs to that family as much as what it used to.
And in fact, one of the things I do with a lot of patients, especially when they're experienced cannabis users, I don't change the whole world, they know what they're doing. But we think about it differently as a medical person. We look at the duration of action, the blood levels. We think about that without even talking about it. Dr. Hergenrather does the same. I can see him calculate it in his mind as he talks about these concepts, And we can actually significantly reduce the amount of money people spend. Talking about that 90-gram level, that's quite common, Some people more. But we can bring that back down, add in a little bit of oil, extend the duration of action, create a plasma baseline level, add a bit of fat in there so it extends out even further, add some CBD to slow down that initial conversion to the 11-hydroxy-THC, extend the duration of action. All of a sudden, the patient doesn't need that 90 grams. They only need 20, 30 grams, and they're getting a great night's sleep, and they've saved themselves $7,000, $8,000 a month, So, yeah, times are changing. It's really looking up. It's really, really looking up. I feel actually like I don't get spat at or sneered at now when I talk to in front of conferences. Later on this year, I'll be presenting at the GPCE, which is one of the biggest GP conferences that tours around all the capitals of Australia every year, and that's a big deal. We've got invitations to talk at public hospitals and private hospitals in and around Brisbane and Queensland. So the acceptance of cannabis medicine, it's happening, it's real. And a lot of these people, these less scrupulous companies that are chasing the quick dollar from the recreational crossover flower market, they're neglecting the bigger picture. The bigger picture is that chronic disease in Australia is over 50% of the population. So over 50% of the people in Australia right now are amenable to cannabis medicine in some form. And everyone's chasing the 10% of weed smokers that already exist. What about the 50% that already exist? And what about we focus our efforts on making the whole population feel better, not just servicing the needs of a rec market? So, yeah, that's one of the things that gets me fired up. But I think we should talk about some of the beautiful things we've seen as well. So I'll hand over to Chloe for a beautiful one.
Absolutely. With medicinal cannabis, and one thing I did notice in the early phases is introduction of cannabinoid medicines to a naive patient can be an incredibly daunting and scary process, usually based off of the education the patient has had before this point. A lot of people are still very much plagued by the propaganda that we saw during Prohibition and that we still see now. And a lot of patients that come into the clinic are generally scared. They're scared they're going to overdose. They're scared they're going to stop breathing. They're scared the lady at the bowls club's going to find out that she's on a CBD. There is so much fear sitting behind these patients. Really, there is no base for this fear at all. So within PlantMed, introduction of cannabinoid therapy to a cannabis naive patient is taken incredibly seriously. We have a whole team of care coordinators that will phone and check on the patients and ensure that during the first 3 weeks of treatment we're not having adverse side effects. But the most amazing things will happen in the initiation of cannabinoid therapy into cannabis naive patients. I do tend to find that there is a massive change in the spirituality of that person, whether they're aware of it or not. There's a massive change in their independence and what they are willing to accept to be right for themselves versus before they commence cannabinoid therapy. I've seen patients' psychic abilities enacted through the titration of cannabinoid therapy as well. So there's a lot of spiritual aspects of cannabinoid therapy that we aren't focusing on but are taking place naturally within that person. And from someone who has witnessed cannabis their whole life, I feel that one of the main reasons that this medicine has been prohibited for so long is that because it creates independence of the mind, independence of the human. Once that happens, it's hard to control a society. So we are right now on the precipice of something incredibly massive that in the next 30 years we're going to see happen globally. But we are literally activating the humanity in the humans again. And it's being done by the plant, and it's being done because it's needed. And I personally feel if we don't do it now, humanity doesn't look good. So let's really focus on making sure we get these cannabinoids to the people that need them, and then start to change the thought patterns in our societies.
That's so true.
Yeah.
There's some really, really well put.
Yeah.
Really, really well put. You know, don't tell anyone. Shh. We've got this chance for, the fancy words for that's epigenetic change. So we've got the opportunity for that now in our society. Right now, across the world, there's more cannabis growing than there ever has been, ever. In over half the countries of the world, it's either medical or recreationally legalised. There's billion-dollar industries on every continent focused on growing marijuana, growing cannabis to high quality for recreational and medicinal purposes. So at this point right now, I think in the war on drugs is definitely winning. We're definitely ahead, you know, and it's a beautiful thing. I treat a lot of kids in the course of my practice, and I think it started out because there was no other choice, I suppose.
Yeah.
And most people don't want to treat children, especially with cannabis. It's too scary, it's too dangerous. And there's a lot of societal stigmas. But I've been a disciple of Dr. Hergenrather's for my whole life, since cannabis started for me. So thank you very much for sharing your knowledge over the years and being so generous with your time. And I think it was, you know, watching a lecture or listening to some of the comments about treating children and autism and ADHD that got me going into it. And then I was fortunate enough to meet some other lovely people from the American Society of Cannabis Clinicians and learn from them. And now I treat lots of kids. And we start with those sort of CBD dominant medications, but I'm a true believer in full spectrum all the way, never an isolate from the start. But there is certainly, I'm a bit cautious because of the legal frameworks and the societal perceptions of mothers and the family, but I do introduce significant amounts of THC where necessary. Where is it necessary? In kids with lots of aggression, in those ones that are self-harming heavily, in cases of Tourette's and severe OCD, extra levels of THC and the ratios seem to really help reduce those negative effects. And we see amazing results with these kids. Probably the one that stands out to me straight away is a little boy. And he was just emotionally detached. And that's very common in ASD. There's no hugs, there's no kisses, there's no I love you mums. There's none of that. They're just doing their own thing in their own little world. And it's quite frustrating, you know. I think we treat the family unit when we treat children, not just the kid. And the mums and dads, they're there and they'll love them unconditionally and they're always there for them. But sometimes they'll never ever get a hug. And I called one mum at 3-month point, and I hadn't seen her for a month or so. And I said, any news, anything happened in the last cycle since I chatted to you? You know, the kid was very isolated and insular like that, never hugged or touched mum. And the mum started crying. I remember it, and she just cried now. It's okay, you're all right? Do you need a moment? She said, no, it's just like little Billy, he came up and hugged me on my leg. He came and physically hugged me on my leg, and he has never done that. And that was just amazing. And the feeling, I could feel it down the phone line from this mum, just this amazing feeling of thankfulness, gratitude and hope and love for that child all mixed into one. And that really sticks out to me. And that's a simple thing, you know. It wasn't There's kids that or adults that have 30, 50 epileptic seizures a day. They're down to nothing now. They've been seizure-free for 2-3 years under our guidance. I've seen remissions from cancer, and not all cancers are amenable, that's very true. But certainly breast cancer seems to be amenable. We've had a good handful of metastatic breast cancers with lesions in the bone and hips, spine and liver gone into remission. We've seen the shrinkage of brain tumours. It's really, really gratifying job actually in that sense, yeah.
Very heartwarming. It's the courtesy calls I never completely underestimated how incredibly rewarding they are. To see a family in a space of 3 weeks go from a child who just sits in the corner and rocks to a child that can now make eye contact with the parent, or a child who will, for the first time ever, verbalise to their family that they love them, or to see siblings starting to play together instead of beating each other up and pushing them through walls, to see children go from no attendance at school to 100% attendance and representing their state in sports. These families do not actually, they're so in shock as to the outcomes that they're getting that you can't get them off the phone. You know, it is absolutely amazing to see the changes in their lives. And then that makes me question, well, what if this child who's now 11 had access to this medication 8 years ago? Where would her life be? Where would her education be? Where would the family be? You know, there is so much trauma carried within these families when we've got very unwell children who don't respond to treatment, that when you can just treat that child, the entire family demographic changes. And we're not just talking about kids. If we take a mother with fibromyalgia and we manage to control her pain and her inflammation to the point where she can get back and take the kids back to school and start being there for her family. These things, they're immeasurable of what they actually do to that family unit and then what that does to the community around there. And we see it every day. It's absolutely rewarding. When our nurses start in the clinic and they're doing the nurse consults, checking up on long-term patients who are stable, the first 4 weeks of a nurse in the office, they're just constantly just wide-eyed. Can you see this? This is a remission. Can you see this? We've gone from 35 meds down to 2. And everyone else is just like, oh yeah, standard day in the office. But when you're coming from a standard medical role into something more plant-based, these types of results you don't see every day. So when people come into cannabis medicine, they are so in awe of the clinical notes that they are reading that it takes them 2 or 3 months just to calibrate into the level of clinical success that this medication can give.
And what we're doing there, our secret technique, and it's not secret at all, our secret technique is we're supporting that endocannabinoid system. We're treating the endocannabinoid deficiency that Dr. Hergen rather briefly alluded to. So with ASD, with epilepsy, with multiple neurological disorders, we do know that the level of circulating endocannabinoids such as anandamide and 2-AG are actually slightly reduced compared to a normal population. So why is that? Why is autism gone from less than a percentage of our population 20 years ago to over 10% of our population in Australia now? Why is that? When did we stop eating cannabis? When did it stop becoming readily available to us? When was it stop being fed to our herbivores that we eat? So it seems to me that it's very coincidental since prohibition and that then lack of cannabinoid input into our bodies for generations, 4 or 5 generations of people now, that we've developed a societal endocannabinoid deficiency, and we need to fix that up. We need to fix that with nutrition, and we need to fix that with the plant, and we need to make it readily available for people. And these results we're seeing with some of these kids, it's not on massive amounts of cannabis. It might be on, 50 milligrams of CBD twice a day with 3% THC in it. You're seeing these amazing results. Anxiety, everyone in our whole world is anxious. For good reason. The whole world's stuffed. There's wars, we're getting restricted, there's money pressure on us, everyone is stressed, and we've seen it in the clinic. Everyone is stressed that comes through those doors. And the big thing that cannabis does is relieve stress. It turns on that parasympathetic, that relaxing part of our nervous system, the one that will let us actually sleep, recreate, and forget. That's what cannabis is doing, and that's what we need to do as a society. We need to chill out in an organised way, in a physiological way, and we can give ourselves such a cheap and simple thing. And I'll let Chloe talk in a sec because we're running out of time, but I think where I want the industry to go right now is, I think it's going great. You know, we've got access to over 1,000 different cannabis medications in our inventory in Australia right now, 1,000 different separate products. But what I would like to see is, I'd like to see Australia use what we're good at, agriculture. I'd like to see us convert some of our wheat fields or our cotton fields or some of our land into broad-scale hemp, high CBD cannabis production. And I'd like to see it distributed for free by Medicare at least 30 milligrams twice a day for the whole population. That's what I would like to see.
And really, let's have a think about the cost to the government for that. What if every mild inflammation we could treat with cannabis first? What if mild insomnia, mental health conditions, endometriosis, all of these chronic conditions that are weighing in on our public health system every day, what if we could have access to a medicine in the early stages, not end stage, that would allow us to drop back the level of chronic disease that's going to manifest into? I really think like our governments need to actually really look at the medical outcomes of cannabis and apply that to a lot of the portfolios we can get massive savings in, particularly in public health and particularly in disease progression. Let's also think of our economy, employment. How many people could we employ? We've got exportation rights for this medication right around the world. What if we did do broadacre CBD production and cannabinoid production? How many people would that put into employment? So this is more than just health. This is about finding a very good solution for humanity in the future.
Thank you. Thank you.
Any questions, anyone?
I'll swing a mic around there if anyone's got any questions.
Are you from Queensland?
Yes, we're in Brisbane.
Right, well, we're in New South Wales, so there are different laws to the things. So, like, I know that we can only get 20 grams of medical marijuana compared to what Queensland gets.
That's incorrect. So the amount of
New
cannabis...
South Wales.
We treat in New South Wales as well.
Yeah, we treat Australia-wide. The rule is that there's no limit. It's at the discretion of the prescribing doctor that's giving you that medication. So they may have a personal limit and their own morality of 20 grams, but it's certainly... There's no prescribed maximum amount of cannabis you can sell.
Please use the microphone.
It's definitely the same for New South Wales, so it is definitely the same. Yeah.
Yeah, I'd like to know where we can do it, because I know lots of people who are on medical marijuana and can't afford it because it's more expensive than the black market. At the end of the day, you're paying, this is honest truth, you're paying 20 grams, $600.
No.
Yes, that's what
You can pay that.
You can pay that, absolutely.
And then you're getting on the black market for $400. So you weigh it up. When you're on a pension and you're, like myself, one leg, I have to weigh that up.
Yeah,
the government cost, I can't do. That's 20 grams. That's supposed to last me for a month.
I know for a fact, 100% fact, because I wrote the numbers in the software myself at our clinic, and we sell Australia-wide, that the most cost-effective cannabis flower it's a 22% White Widow Haze Cross for 15 grams for $99. We have 4 other strains. We don't focus on the budget strains that much, but we have 4 other strains that are $99 for 10 grams. So that's $200 an ounce or $300 an ounce.
And at the end of the day, there are people out there charging that, and that's not right. So as a consumer, when you get your script, you phone every pharmacy and you find out what you are going to pay. You look at the supplier's website, it will have a recommended retail there. It should not be hundreds and hundreds of dollars over your recommended retail. In our clinic, we sell under recommended retail. So what this is about really is finding a doctor and then therefore a pharmacist that understands a patient and the financial need. There are people out there money grabbing everywhere, and this is one of the biggest problems.
I swear to God, even my flatmate, okay, he's got brain injuries and they've said to him, you can do it. He can't afford it. Like, there's a big difference.
This is one of the problems with not being able to advertise.
Yeah, we can't advertise.
So we've got some big guys floating around on Facebook. They're popping up their free consults. Come and get your medicine here.
Then you pay more for the medicine.
You pay triple what you should be paying for your medication.
That's what I'm trying to...
Yeah, that's right. They're the unscrupulous people we're talking about.
Yep.
So we actually at PlantMed have a other patient crossover stream. So if you're with another doctor and you show us your script or whatever and prove that you are a medical cannabis patient, we have a discounted stream that fast tracks you through. You talk to the nurse first, they just quickly have a chat to you, then you'll talk to a doctor, and we transition you straight into our care where we have multiple options. So anybody, PlantMed, sorry, so many companies.
PlantMed, yeah.
PlantMed.net.au, plantmed.net.au. Check it out if you want to book in. Any other questions?
Yep, we'll come with you. Microphone.
Hi. What's your opinion on high-dose cannabis for therapy and also for bipolar and schizophrenia?
High-dose cannabis for, what was the first part?
For therapy, so like a 6-hour therapy session.
Psychotherapy?
Yeah.
Yeah.
And also, is it safe for bipolar and schizophrenia?
So I think we don't, at PlantMed personally, do psychotherapy in those sort of extended one-on-one durations. So I think that's definitely a specialist field. I think the use of cannabis in those settings is totally applicable. I think you can use cannabis as a sacrament, something that focuses your attention on the internal feelings and workings of your body, makes you aware of the way your mind may be thinking about things, especially with the support of that therapist. In terms of bipolar and schizophrenia, if you have got those diseases or you've got a very strong family history of those diseases, THC can unmask or exacerbate or potentially bring out, actual symptoms of schizophrenia or manic episodes through the use of THC. Saying that, CBD has antipsychotic properties. So it's a slippery slope. A lot of patients come in with those conditions to me and are using cannabis. They like it, gives them certain benefits, but I can also see that it sometimes tips them into the manic side of things or tips them into that negative mental health space. Yeah. Usually they're not using enough CBD by a long shot. So there's one study that's been done on CBD that I know about, comparing it to a standard antipsychotic, and we know that at a standard dose, this antipsychotic holds on to dopamine 2 receptors at a certain strength. By comparing how strong the CBD holds to those receptors, we can sort of guesstimate the dose equivalents. So an antipsychotic dose equivalent for this aripiprazole drug is actually in the range of 550 to 1,100 milligrams of CBD in a dose. So that's quite a large dose for what most people take. It's certainly safe. It certainly brings you into the cytochrome P450 liver metabolism area. But it has been shown to have an antipsychotic effect at those levels. And that's also through observational trials as well. So it's not something which you undertake treating someone with bipolar and schizophrenia lightly. I do it with THC, but there's always a massive predominance of CBD to offset those negative effects. And I've got one example in my mind, a floridly psychotic man. He's had florid psychosis for his whole life, polydrug abuse, a real shaken up individual. Came to me after a psychotic episode, after an amphetamine issue, ended up in the psych ward, known to the psych ward, florid psychosis. But we've had him psychosis free for now 6 months under really careful attention and care. We've giving him doses in the region of that 500 milligrams of CBD a day, which is expensive, but he's willing to do it. He's got the money and funds and to be able to do it, luckily, and he's willing to go along with what I say. And it was hard to get him to go along with what I say, but now now he does. He's in a really great spot, and he's thankful for that. And he's actually in a mentally well spot, the best spot he's been in for years. So the answer is yes, you can do it, but please do it with some supervision. Please get someone to help you out and make sure that you're doing it correctly, because you don't want to trigger yourself into bipolar episodes, manic or depressive episodes, or schizophrenic episodes or psychotic episodes, because they're not fun, okay?
No. And going back to that, and I'm just speaking personally here, I think, for an intensive treatment like that, your dose would have to be quite high, and the side effects to get a standard patient to that dose may be something that could be off-putting. But definitely with cannabis, there is a subtle change of the mind that takes place the moment treatment starts, and it's something that it's so subtle that usually the patient themselves don't notice the changes that are taking place, but the carers around them do. So I think there is a lot of benefit with just a standard cannabinoid regime on a daily basis that really begins to start to change the foundation of the mind. And I've seen that in patients with PTSD who've never been able to remember what has taken place. I've also seen that in PTSD patients who've been unable to forget. So it really, cannabis just works on what's missing in your treatment. So it's something that is incredibly personal. You can never actually label what's going to happen or what type of insights you're going to have within your treatment, but they are quite profound as you move through cannabinoid therapy.
Hi, I'm interested in your opinion on the application of suppositories for reproductive issues like, say, endometriosis, and also on back pain, and in general, your take on suppositories, please, John.
Yes.
So suppositories are a way we use to ingest medicine up the bum. When you do that, you've got probably about 2 inches of space to do it in. So you can only push it up so far, and then your body will push down again, naturally. And so you've got about 2 inches of surface area to absorb things in. Theoretically, the absorption through that area is very good. And some of the studies show very good absorption, but they were using an absorptive compound called, what's it called? DMSO or DSMO or something like that. Mm-hmm. No, hemisuccinate. But anyway, a thing that gets things into your body through those mucous membranes quickly. So in that case, it did show noticeable blood levels from suppositories. If it's not with that, the data is a lot less clear. So there's a lot of problems with suppositories in the fact they can leak out again. You haven't got the surface area. So if you eat something, yes, it's got to go past your liver, which is one of the big claims for suppositories, and it gets slightly metabolized, but it's going to happen anyway. But you've got meters and meters to absorb those molecules in. When it's going up the other way, we've got that 2 inches. And so my personal feeling on it is that although theoretically it's a great idea, when people use suppositories in large doses, even for THC, often they note less or no psychoactive effect, no high feeling. And that makes me think, well, are you getting good systemic absorption? If you're putting a gram of THC up your bum and you don't get high or a feeling of highness, do you have a plasma level? And these are the things that I haven't got firm data on, but I don't feel confident to entrust, say, a high-dose cancer treatment to only suppositories. If someone wants to use suppositories, great, we can add them in, but I would still like to treat systemically orally. Yeah, go both ends, why not, if you're really serious. In terms of local treatment for things like endometriosis and cervical or uterine pain, fibroids, yeah, I see the more, rather than suppository, I'd probably go more for a vaginal troche, where that could be also beneficial. But once again, I would treat systemically as well, because it's through the blood that the majority of the compounds will get to the target organ, the endometriosis or the uterus or wherever you're looking for. So yeah, that's my feeling on it. I think it's a thing you can do, but I wouldn't, if I was really sick, I'd probably do that too. But I would be focusing on systemic treatment, especially if I was treating myself for cancer or bowel disease or anything. Yeah, I'd focus on the systemic treatment.
Certainly cannabinoids in women's health they go together very, very well. I've seen amazing cases of endometriosis in the clinic. I've seen women who have never been able to conceive have their first viable pregnancy. We've got one patient who's had a myriad of health conditions. The fetus has never grown. She's commenced a full extract CBD oil. The fetus is now growing. She's got a viable pregnancy. She's lost 6 pregnancies before this. So there is many, many examples out there that we see every day. And her pregnancy team are saying, what are you doing different? And she's so afraid to tell them what she's actually doing.
In case she jinxes herself.
Correct, in case she jinxes herself. But, you know, she's now 5 months into a pregnancy, which is the furthest she's ever been in a viable pregnancy. So, you know, fingers crossed, let's hope it all goes well. But every day we see all sorts of amazing things like this that don't fall into a standard category of health and wellness.
Anyone else out there with a question?
Yep, coming your way.
Hi, thanks. I'm Damon. I was just going to pick up on that point you mentioned before about the balance of THC and CBD. It's fascinating to me because both of them do obvious great things for you. And yes, the idea of getting pretty out of it on THC and not having a balance of that sort of almost psychosis period someone can go through if they have a, you know, hydro, whatever. So bringing it back to the oils, what is a good way for the punter to try and balance that just so that they can have a normal...
Great question.
Yeah, really good question. Yeah, so for someone who's just here, right? You're just here, you want to make your cannabis use better, healthier and easier? Pick up a bottle of CBD. Take about 30 to 50 milligrams twice a day. And that'll just smooth it right out. 30 milligrams in the morning, 30 milligrams at night. That's the lowest, that's where we start. You know, I know that's heavy-handed for some people. That's not for me. So we start about 30 to 50 milligrams twice a day, and that seems to be an effective amount for your average smoker to balance out their cannabis use. If you're really punching 30 cones, 40 cones a day, well, you might need more.
Can I ask, how much is that on a teaspoon?
How much does it cost? Oh, on a teaspoon. Oh, a teaspoon.
How much is 30
only
grams
about
on a teaspoon?
a fifth of a teaspoon.
Fifth of a teaspoon.
Depends on the concentration of the oil.
Yep, right.
Okay, yeah. So you can certainly just go to the hemp embassy there and get their standard CBD oils. Half a dropper will be about right, and away you go. You know, with CBD, it's very forgiving. Another way I like to do it for current and regular cannabis smokers is provide them with a CBD flower. So something that's 14, 16% CBD, 1 or 2% THC, and say chop that in with your high THC flower. So you mix it, depends on your ratio you want. If you're a really anxious person, you go half-half. If you just want to take that anxious edge off and you're an old smoker, just put, you know, 1/5, 1/6 CBD in there, and you balance it to yourself. Yeah, and that's
good.
getting your balance back, right?
Yeah.
Yeah.
That's what we want.
It's amazing how fast CBD will work. So in a recreational party setting, I've seen where people have consumed cannabis after large amounts of alcohol, severe drops in blood pressure, vomiting, nausea, they're on the ground. 5 minutes after a dose of CBD orally and the patient is back up. We've seen this in the clinic as well when we had one carer try to push the introduction of inhaled flower on a naive patient. He sat there for 2 hours with incredibly low blood pressure, unable to move. Straight after a CBD dose, and I'm talking 5 minutes after a CBD dose, he was standing and able to leave. So we really can't underestimate what CBD can do, particularly if we are in a recreational party setting or if we have got a naive patient who has consumed high THC. CBD immediately administered afterwards will take away any of those unwanted side effects.
Yeah, and from the pharmacokinetics, that shouldn't work, right? It should take an hour to get into you.
Orally, through the
orally
left
though,
in the
but,
mouth, I mean.
you know, we just, in that sort of situation, it'll be like 100 milligrams, the whole tube just squirted in there.
Yeah.
And a little bit must get in quick and the rest gets in later. Because you get a little bit of oral absorption, sublingual absorption maybe. But yeah, that's the key, just to balance it out with a little bit of CBD. The more the merrier. In my books for CBD, I personally take about 300 milligrams a day because I just love it. It's just me, you know. Next question, if anyone has any.
Do we have any more questions? We can, you're always welcome to chat to Chloe and John afterwards. So, okay, it looks
Thanks
like
very
you're
much.
it. Thank you
you
so
very
much.
My pleasure.